We often see videos and images of breasts on our phones, and we start to believe that only one specific size and shape is normal. We think anything outside of that is abnormal or even wrong. Hello, and welcome to Women Things. Today, we are bringing you the essential knowledge to feel confident and informed about your body. We are diving deep into 8 normal things about breasts that every woman should know. 1. No two breasts are the same size. If you've ever looked in the mirror or felt yourself and noticed that your left breast is slightly smaller, or your right breast is slightly bigger, you are right, and that is completely normal. It's called breast asymmetry, meaning the left and right sides are not perfectly equal. This happens to everyone, and a slight difference in size or shape is absolutely normal. 2. Areola color varies widely. The color of the areola, the darker skin around the nipple, can vary. It can range from anything like bright pink to deep brown and every shade in between. The areolas you see in the media, perfectly pink, bright, even in color, are often edited. I frequently have patients or followers who ask, "What treatment can I get to change the color of my areolas?" They feel shame, but if something isn't a problem, why change it? Own it and accept it. 3. Breasts sag and change. Just like the skin on your face gets a little wrinkled or loose, and the skin on your neck loses elasticity, your breasts will also sag and droop over time. There is absolutely nothing wrong with this. You don't need surgery as long as you aren't experiencing any pain, extreme discomfort, or severe skin discoloration. Sagging is simply a normal part of life and the process of aging. 4. Hair on breasts is normal. How many times have I received messages from women saying, "I think I have a disease because I have a lot of hair around my nipples or hair on my areola. What should I do?" They often remove it immediately, which is the worst possible reaction. You need to know that any kind of hair around your breasts is completely normal. It is all related to your hormones, specifically androgens and testosterone, which determine hair quality and quantity. If we compare bodies, hair appears on women where it also appears on men, just typically less dense. Unless you have excessive hair growth that appears suddenly and is a lot more than before, you do not need to worry about it. 5. Nipples can be flat or inverted. Let's talk about the nipples themselves. Whether they are flat, directed outwards, erect, or inverted, this is all normal. Erect nipples are a very common situation when you feel cold or aroused. During the teenage years, they may be erect for long periods, and there's nothing to worry about. If a nipple that was previously erect suddenly becomes inverted or vice versa, and there is an accompanying discharge, that could be a cause for concern. But otherwise, inverted nipples are often a permanent and completely normal trait. 6. Small bumps on the areola are sweat glands. Many people worry when they see small bumps or tiny boil-like structures around the areola. Let me clarify what these are. These are sweat glands, which we call sebaceous glands in medical terms. You use deodorants and perfumes on your body and near the armpits where you have sweat glands, right? So why worry when you see them around the nipple? They are normal and part of your natural anatomy. 7. Areola size fluctuates. People often ask, how big should my areola be? First, let's understand what the areola is. It's the brown or dark-colored area surrounding the nipple. It can be small or large. If you gain weight and your overall breast size increases, your areola may also become larger. Also, if you are under stress or enter a cold environment, you might notice your areola appears smaller for a few days. Don't worry about these fluctuations. They are normal. 8. Breast tenderness and heaviness is normal sometimes. I get many questions from patients who say, "I feel heaviness or pain in my breasts a few days before my period." You need to know that sometimes this is normal and sometimes it's not. It is normal for breasts to feel heavy or tender in the days leading up to your period. This typically subsides within 2 to 3 days. Just like premenstrual symptoms, PMS, can make your lower abdomen feel heavy or painful, they can also affect your breasts. However, if you have excessive pain you can't deal with, or if the pain comes with a discharge, a noticeable lump, or severe discoloration, that is not normal and you should see a doctor as soon as possible. Now that you know what is normal about your breasts, you can push back against the standard, often fake, perfect image that society and objectification have created. Accept, own, and love the breasts you have, whatever their shape or size.